If you take 5 or more medications, and lately your body feels different, there is one question that may be worth asking. Is this really just aging? Or is my medication list trying to tell me something? Maybe you feel a little dizzy when you stand up. Maybe your balance does not feel as steady as it used to. Maybe your mouth is dry all day. Your vision seems blurry. Your digestion has slowed down. Or you wake up feeling foggy even after a full night in bed. For many people over 60, the first explanation is simple. I guess I'm just getting older. And sometimes age is part of the story, but it may not be the whole story. When you take several medications, especially 5 or more, new body changes deserve attention. Not panic, not guessing, and definitely not stopping anything on your own, but attention. Because many medications are helpful, necessary, and sometimes life-saving. Blood pressure medicine, diabetes medicine, heart medicine, pain medication, sleep medication, allergy pills, stomach medicine, vitamins, and supplements may all serve a purpose. The issue is not that medication is bad. The issue is that the body changes with age, and a medication plan that once felt simple can become more complicated over time. Doctors often use the word polypharmacy when a person regularly takes 5 or more medications. That can include prescription drugs, over-the-counter products, vitamins, herbal supplements, and anything taken regularly for sleep, pain, digestion, allergies, or energy. For older adults, this is very common. You may have one doctor for your heart, another for arthritis, another for blood sugar, and maybe a different specialist for sleep, pain, or bladder symptoms. Each medication may have been started for a good reason, but over months and years, the full list can grow quietly. And when the list grows, it becomes easier to miss connections. A symptom appears. You feel lightheaded. You feel tired. You become constipated. You notice dry mouth. You feel more forgetful than usual. You almost fall while walking to the bathroom at night, and instead of asking, could this be related to something I'm taking? Many people simply say, well, this must be what getting older feels like. That assumption can be risky. One reason is that the aging body may handle medication differently than it did years ago. The kidneys and liver help process many substances in the body. With age, the way medicines are absorbed, processed, and cleared can change. Body weight, hydration, muscle mass, and sensitivity to medication can also change. A dose that felt fine at 55 may feel stronger at 72. A combination that never bothered you before may become more noticeable after one more medication is added. This is especially important when several medications have similar effects. Some can make you sleepy, some can make you dizzy, some can affect balance, some can slow digestion, some can cause dry mouth, constipation, blurred vision, trouble urinating, or mental fog. One medicine by itself may cause only a mild effect, but several together may create a bigger problem than anyone expected. That does not mean one pill is definitely to blame. It means the pattern is worth reviewing. One of the clearest signals to pay attention to is dizziness, especially when standing up. If you rise from bed or get out of a chair and suddenly feel lightheaded, it can have many possible causes. Blood pressure, hydration, circulation, inner ear problems, blood sugar changes, and medication effects can all play a role. But after 60, dizziness matters because it can lead to falls. And a fall is not a small event when you are older. It can change confidence, independence, and daily life very quickly. Another signal is feeling unusually foggy or confused. Everyone forgets a name once in a while. Everyone has slower mornings. But if your thinking feels cloudier after a new medication, a dose change, or adding an over-the-counter sleep aid, allergy pill, or supplement, it is worth mentioning. Some medicines can affect alertness, memory, and concentration, especially in older adults. This is one of the reasons medication-related symptoms can be so easy to miss. Brain fog can look like aging. Sleepiness can look like low energy. Balance problems can look like weak legs. Constipation can look like a diet issue. But sometimes the medication list needs to be part of the conversation. Constipation is another common example. Many older adults deal with it quietly. They may blame age, low fiber, not drinking enough water, or not moving as much. Those things can matter. But some medications and supplements can also slow digestion. Certain pain medicines, iron supplements, bladder medications, and other drugs may contribute in some people. The safe question is not, which medication should I stop? The safer question is, could anything I take be contributing to this? Dry mouth may sound minor, but it can affect eating, speaking, sleeping, taste, and dental health. Some medications can reduce saliva. When several medicines have drying effects, the result can become more noticeable. A person may sip water all day and still feel uncomfortable, without realizing that the symptom may be linked to the medication list. Blurred vision deserves attention too. Vision changes can come from many causes, including eye conditions, blood sugar changes, dry eyes, or normal aging changes. But medications can sometimes contribute to blurry vision or trouble focusing. If the change is new, sudden, or getting worse, it should not be dismissed. Trouble urinating is another symptom many people feel embarrassed to talk about. But it is important. Some medicines can affect urination, especially in older adults. Men with prostate issues may notice this more, but women can also experience changes. If urination changes after starting something new, or after a dose is changed, bring it up. Then there is fatigue, one of the most confusing symptoms of all. Fatigue can come from poor sleep, low activity, pain, depression, anemia, thyroid problems, heart issues, blood sugar swings, stress, and many other causes. But medication effects can also be part of the picture. Some medicines may make a person drowsy. Some may interfere with sleep quality. Some may lower blood pressure too much. Some combinations may simply leave the body feeling slowed down. This is why a timeline is so useful. When did the symptoms start? Did it begin after a new medication? Did it begin after a dose was increased? Did you add a supplement? Did you start taking an over-the-counter sleep aid, allergy pill, pain reliever, or stomach medicine? Did another doctor prescribe something without seeing your full medication list? These details matter. They help your doctor or pharmacist see patterns that may not be obvious during a short visit. There is also something called a prescribing cascade. This can happen when a side effect is mistaken for a new health problem, and then another medication is added to treat that symptom. Over time, the list gets longer, but the original cause may not have been fully reviewed. This does not mean anyone did something wrong. Healthcare is complicated. Many people see several doctors. Medication lists change. Over-the-counter products are easy to buy. Supplements get added without much discussion. And unless someone looks at the full picture, important connections can be missed. That is why a medication review is one of the most practical safety steps for older adults. A medication review means sitting down with a qualified healthcare professional and going over everything you take. Not just prescriptions, everything. Pain relievers, allergy pills, sleep aids, vitamins, minerals, herbal products, eye drops, creams, stomach medicine, laxatives, supplements from the internet. Anything you take every day, every week, or even only when symptoms appear. This matters because supplements are not automatically safe just because they are called natural. Some can interact with medications. Some may affect bleeding risk, blood pressure, blood sugar, or sleepiness. Some may not be appropriate before surgery or for people with certain medical conditions. A simple habit can make this much safer. Keep one updated medication list. Write down the name, dose, why you take it, who recommended it, and when you take it. Include prescriptions, over-the-counter products, and supplements. Keep the list in your phone, wallet, or a notebook. Bring it to appointments. Bring it to the pharmacy. Update it whenever something changes. If possible, using one pharmacy can also help. A pharmacist who sees your full list has a better chance of noticing possible interactions or overlapping effects. It is not perfect, but it adds another layer of protection. And do not assume that a medicine you have taken for years can never become a problem. The question is not whether it was useful when it was started. The question is whether your current medication plan still fits your body today. But the most important message is this: never stop a medication on your own because of something you hear in a video. Some medications can be dangerous to stop suddenly. Some need careful adjustment. Some protect against stroke, heart problems, seizures, blood clots, severe pain, or serious disease progression. If you are worried, the answer is not fear. The answer is a careful conversation. You can ask your doctor or pharmacist, could any of my medications or supplements be contributing to this symptom? You can ask, do I still need everything on this list? You can ask, are any of these combinations risky for someone my age? And you can ask, is there a safer way to manage this, or should we simply monitor it? If you have fallen, nearly fallen, fainted, felt suddenly weak, become severely confused, had chest pain, trouble breathing, signs of stroke, or a serious allergic reaction, do not wait for a routine appointment. Seek medical care promptly. For urgent or severe symptoms, use emergency services, but for symptoms that are not urgent, yet are new, persistent, or getting worse, schedule a medication review, especially if the change started after a new medicine, a new dose, or a new supplement. The goal is not to be afraid of medication. The goal is to use medication wisely, with regular review. As your body changes, after 60, a new body signal may have more than one explanation. It may be aging, it may be sleep, it may be nutrition, blood pressure, blood sugar, hydration, pain, stress, or a medical condition. But if you take 5 or more medications, your medication list belongs in that discussion. So remember this. Do not panic. Do not guess. Do not stop anything by yourself. Write down what changed. Notice when it started. Bring your full list. And ask your doctor or a pharmacist to review it with you, because sometimes the most important health step is not adding one more thing. Sometimes it is making sure everything you already take still makes sense for the body you have today. If you want calm, clear explanations about health after 60, subscribe for more videos that help you understand what your body may be telling you without fear and without confusion.